is that we've put God and religious ideas aside, so we think, and we've slowly put our governments and our experts and our authorities in the place of either the deity or the church or something like that, where it seems to me there's been a significant reversal when it comes to people's attitude towards COVID vaccines. At our peak here in Canada, fully 85% of the eligible population had their COVID vaccines. So what that means is there's 15% of the people at the time, at the peak, that didn't get their vaccines. Now, several years after, looking at the most recent numbers, things have reversed. Now it's only 15% of people, of Canadians, eligible Canadians, who are up to date on their COVID vaccinations. So that means that a full 85% of people are not up to date in their COVID shots. There was the 15% who were vaccinated back then and have stayed up to date even now. There's the other 15% who weren't vaccinated back then and almost certainly are not vaccinated now. But it's that 70% in the middle that I find interesting. So that's roughly 2/3, or a little bit more than 2/3 of Canadians changed their opinions on COVID vaccinations. That is, there was a time when they were compliant, when they took their vaccine, but now they're not staying up to date. So why the change? I think there are probably a number of factors that would go into someone's decision to not maintain their vaccination. There's probably multiple things that apply even to the same person. I think people today are much less scared of the virus itself. People have probably had it at least once or twice, maybe 3 times, recovered from it, and they're now less concerned about getting it. The other thing that's changed is there's much less social pressure nowadays to be vaccinated, both the sort of soft and hard social pressure. There's the hard pressure, or what you might call coercion, where our schools and our workplaces required people to prove their vaccination status before continuing to work or continuing to go to school. Those policies, as I understand it, have largely stopped. And I suspect that a lot of people, for various reasons, have just fallen out of the habit of staying up to date in terms of their vaccine. And this is interesting, and it's also interesting that almost no one is talking about it. We're not talking about a small number of people, we're talking about most people out there. I think the underlying reason that these people have changed their mind is because the official coercion and manipulation has stopped. By and large, that full court press of trying to get people vaccinated, coming from our news media, coming from our politicians, coming from our health authorities, etc., that has largely gone by the wayside. So I would suspect that those 70% of people represent the number of people who basically participated in an experimental medical intervention solely or primarily because of coercion and manipulation, not because they made a rational decision. The people that are truly bought into vaccines, they're still getting it now despite the mandates being lifted. The people who were skeptical from the beginning and still haven't participated, they kind of held their ground despite the coercion. But I would suggest that 70% represents the portion of our population that was affected by specific efforts at coercion and manipulation. Coercion and manipulation from our politicians, both or federally, provincially, and even at a local level. Manipulation, coercion by our health authorities, by the pharmaceutical industry, by news media, by academia, by, other authorities. Basically what you could call the people who were manipulating and coercing. These are what you might refer to as the elite classes among us. The policymakers, the politicians, news media, university profs, etc., etc. So it's interesting. I'm not sure how many people are arguably in that elite class. I assume it's relatively few in the grand scheme of things. Yet it's interesting that by their efforts, they were able to manipulate and coerce 2/3 of the population to do something that they otherwise likely would not have done. I mean, that's sort of how I'm seeing it, or how these numbers, or the story that these numbers suggest. There's likely all kinds of factors, but I think they mostly come down to when the coercion and pressure is on, you get a certain behavior, you take that coercion away, the manipulation away largely, it hasn't gone away completely, and people go back to how they would have behaved absent that active efforts by our elite classes. So what does that say about our elites? What does that say about those 70%? I don't harbor any ill will toward people who have changed their mind. I know quite a few people who've said either directly or indirectly, actually someone I know quite well over the Christmas holidays. This is someone who's in her 60s but in good health, and she mentioned to me that she's kind of done with getting the next shot, that she sort of felt that the benefit wasn't worth the cost. And by cost I mean not necessarily that she thought the vaccines were dangerous, but just the cost in terms of her time and her energy, and just another thing to think about. Anyway, I just think this is telling. It's kind of scary, frankly, to see how many people, I was going to say how many people can be manipulated. That's not quite fair, because, if we're honest, we're all being manipulated and coerced by various people at various levels all the time. Like anyone who's subjected to advertising, which is all of us, we're manipulated. Each of us as individuals often like to think that, well, advertising doesn't work on me, it works on those other people. But of course it works on us, or else they wouldn't do it. So you buy into a narrative and you get new snow tires, or you buy a new parka, or you get a new cooktop stove, or whatever it is. And these aren't bad things, but it is, like, we recognize with advertisers that they are trying to get us to do a certain thing, and we know that. And even despite knowing that, we succumb to, their efforts. Sometimes because, frankly, they make good arguments. They tell us what it is about their cooktop that's going to make our lives better. It's going to be cleaner or easier to cook on, or whatever. And they actually make real arguments in some cases, or they appeal to our emotions and we either get something or we don't get something. But it's yet another thing when it's not private advertisers trying to get us to sign up for a trip to Cuba or to buy a new car, but it's our government and it's our health authorities and it's our pharmaceutical industry that are coercing us much more than any advertisers could do. Could you imagine if Lexus was able to say, like, you're not allowed to travel until you buy a Lexus, or Samsung says you can no longer attend school until you buy the latest Samsung flat screen? Like, that would be pretty ridiculous, obviously. But that's what our governments did. That's what our health authorities did. That's what our elites did. That's what our universities did. They decided they knew what was better for us, and they were very sure about it. So they said, there's no room for debate, no room for any countervailing evidence to be even discussed. We needed to just do as we were told, and until that happens, they were going to keep us out of restaurants, keep us off trains and planes, keep us out of school, keep us out of polite society. It's pretty chilling. I'm glad we're through it, and I'm glad it didn't sustain forever. But we should pay attention to this. This is because if they did it once, they could do it again. And maybe it won't be COVID, maybe it won't be a disease, it'll be something else. I mean, climate change perhaps. And it's scary to see that there are people who maybe they think they're helping, maybe they think they're coercing us to do the right thing, but it's dangerous. And I think we need to be aware of it. I think we need to be able to talk about it. I think we still need to talk about, like, what just happened in our society. and think about our own actions and how maybe we got caught up in things. And even if we're not willing to discuss it with someone else, think about how we acted and whether we're proud of our actions and what we might resolve to do differently should something like this happen again. Because something like this will happen again, I think. Again, it might not be a disease, but there will be pressure from a government or from some authority to do a certain thing. And I don't know, my personal belief is that kind of thing is outside of the purview of government. I think what's happened in our society, or what is happening, is as a lot of people, and as we collectively as a society have, what's the word? I don't want to say turned our back on religion. That's maybe overstating it. But we used to look to faith and religion and tradition as some sort of ordering principle by which we live our lives. And that, for all kinds of reasons, since the Enlightenment and in the modern era, has fallen by the wayside. In some cases for good reason. There's certainly a lot of corruption in organized religion over the centuries. So I get sort of why we've done that as a society, with the rise of science and technology, seemingly offering better explanations of sort of how things work and how we should be in the world. But I think these things are coming up short. And I think what's happening on some level here is that we've put God and religious ideas aside, so we think, and we've slowly put our governments and our experts and our authorities in the place of either the deity or the church or something like that, where we have this, I guess, desire to follow some kind of overarching principle. I think a lot of people have unconsciously, subconsciously put their faith in government and technocrats who tell us that they've got our best interests at heart and that they have the smarts and the technology and the know-how to make the world a better place. Anyway, I'll leave it there for the time being.